Good morning po to our media partners and to all our viewers live via Facebook and YouTube. Welcome to the Department of Health Beat COVID-19 Media Forum for September 20, 2021. To give us the latest updates on our COVID-19 national situation and COVID-19 response, here is Undersecretary Maria Rosario Ferreira. Good morning po, Yusek.
Good morning, Lindsay, and good morning to all of you, to our media partners, and to everybody watching this DOH Beat COVID-19 Media Forum. Sa kabila po ng pagbagal ng pagtaas ng bilang ng COVID-19 cases sa ating bansa, nananatili pa rin po tayong high risk sa ating national case classification at saka yung ating health systems capacity. Kaya patuloy po kami na nagpapaalala, walang sawa na mananawagan sa lahat na makipagtulungan upang mapigilan ang pagkalat ng COVID-19 sa ating tahanan, sa ating workplaces at sa ating pamayanan. Ang atin pong tamang pagsusuot ng face mask at face shield, pati na rin sa loob ng ating bahay kung kayo po ay madalas na lumalabas at may kasama po kayong senior citizen sa inyong tahanan, palagi ang pag-uugas o pagsasanitize ng ating mga kamay at mga bagay na madalas nating hinahawakan, pagdistansya ng hindi bababa sa 1 metro mula sa ibang tao sa mga palengke, sa groceries, sa pampublikong transportasyon, sa ating mga opisina at sa iba pang lugar na posibleng magkaroon ng pagkukumpulan ng mga tao. Pagsisigurong may maayos na daloy ng hangin sa ating mga tahanan, sa ating mga silid, at ang pagpili sa mga gawaing ligtas sa COVID-19, gaya ng pangsamantalang pag-iwas sa mga mass gatherings or super spreader events, ay malaki po ang maitutulong upang makaiwas tayo sa sakit na ito at mapigilan ang pagkakahawa-hawaan. Kung kayo rin po ay nagpositibo or naging close contact or nakakaranas na ng simptomas related to COVID-19, agad na po tayo mag-isolate at makipag-ugnayan sa ating barangay health emergency response teams para sa kaukulang aksyon. Today, I will be providing the pertinent updates on our biosurveillance efforts, COVID-19 national situationer, and the critical action points that must be put in place moving forward. Next slide. So here are our key messages for today's situationer. The national and some of our regions shows a slowing down in the increase in cases. However, the national case classification and our health system's capacity remains to be at high risk. Cases may still continue to increase in the next weeks due to the higher transmissibility of the Delta variant and as we continue active case finding in the different local government units. We should implement stricter granular lockdowns, shorten the interval between the detection and isolation, and the enforcement of the minimum public health standards adherence so that we can cut the transmission in our communities. We should strengthen triage and referral systems and augment our healthcare capacity to safeguard our health system. And lastly, we should ramp up priority vaccination to protect the vulnerable population. To start, here are the updates on our biosurveillance efforts and the most recent whole genome sequencing run. So these are the distribution of these sequence samples. The total would be 14,156. And out of this, 88.5% or 12,530 had been classified or identified with lineages. The latest run, comprised of 374 samples last September 18, comprises of 13 cases of alpha variants, 9 cases of beta variants, and 319 cases of delta variants, which is about 85% among the 374 samples that were tested. Incoming international travelers comprises 917 or 6.5% among the cases or the samples tested. So next slide. So these are the updates on the 374 sample sequence. And as you may see, it is disaggregated according to the regional areas. And we can see that we had 319 delta cases, 9 beta cases, 13 alpha cases. We had 5 P.3 variant of interest. We had 374 in total. So if you see across the regions, we see that we have detected about 40 Delta variants in Region 2. Region 3 had 23, Region 6 had 22, and Region 4A had 26. CAR had 23, Caraga had 31, NCR had 24, while we detected Delta variants among 18 of our returning overseas Filipinos. Next slide, please. Of the 12,530 sample sequence assigned with a lineage as of September 18, 24.2% of samples were positive for the Delta variant. This variant is now the most common lineage among sequence samples as of the latest whole genome sequencing run. 21.8% of samples were positive for the Beta variant and 19.6% positive for the Alpha variant. 0.02% or 2 samples were positive for the Gamma variant. Looking at the proportion of the variants of concern with respect to the total sample sequence, a gradual increase in proportion has been seen at the national level since the detection of the first local Alpha and Beta variant cases with collection dates on January 3 and February 3 respectively. Variants of concern only accounted for 22.9% of the samples collected in the month of February. In March, however, variant of concern cases comprised 82.8% of the total samples. This increase has been consistent for the succeeding months. At present, for samples collected in August, variants of concern cases now comprise about 97.7%. Similar to other variants of concern, since the detection of the first local Delta variant case was collected in May 29 to be exact, an increase in the proportion of Delta variant cases were seen for the succeeding months. The increased proportion of these variants can be attributed to their increased transmissibility. However, sampling methodology also affects these proportions, as samples from target areas or populations are prioritized more. Such population or areas include samples belonging to clusters, severe or critical cases, admitted cases, samples from areas with sudden increase in COVID-19 cases, fully vaccinated individuals, and cases from returning overseas Filipinos. Infections from these populations are more likely to be associated with variants of concern. In addition to purposive sampling, the number of samples sequenced varied from month to month due to the limited resources available. Targeted population had been prioritized in the sequencing runs done from May to June, which may have contributed to the skew of the variant of concern cases for these months. Among all the sequence samples in the Philippines, 65.6% of the 12,530 samples with assigned lineages are positive for the Alpha, the Beta, or the Delta variants. All regions either have an Alpha, Beta, or Delta variant cases. All national capital region cities were found to have a variant of concern, as well as 601 or 65.6% of returning overseas Filipinos. Looking at the case fatality rate of Delta variant cases across all age groups and between sexes, the highest case fatality rate is observed among the 80 years old and above age group, which comprises about 17.14%. Following the less than 1 to 9 years old age group, the case fatality for the 3 succeeding age groups decreased and would then increase as you go up the age groups. Overall, the Delta variant has a case fatality rate of 2.48% and is twice as high in males than in females. Next slide, please. Now we go to our national situationer. As of September 19, the total reported confirmed cases are 2,366,749, of which 7.53% are active cases, 90.92% are recoveries, and 1.55% are deaths. Looking more closely at our active cases, 98.02% of these are either asymptomatic, mild, or moderate, and 1.98% or 3,532 cases are severe or critical. For September 19, the top 5 regions contributing to these new cases being reported are the National Capital Region, Region 4A, Region 3, 11, and Region 1. And the top 5 areas contributing to these new cases are Cavite, Quezon City, Laguna, Bulacan, and Rizal. Looking at our epidemic curve, we see a new peak every week since the start of August. The average of cases in the recent week is twice as much as the average of cases in the peak we saw last April. Cases from September 13 to 19 recorded 19,963 cases per day, a decrease of 5% from the previous week. As the cases increase, the National Capital Region with the dark blue bars, the Region 4A with the teal bars, and Region 3 with the yellow bars continue to show increase in the proportion of cases. Disaggregating our epidemic curve into the major island groups and the National Capital Region plus areas, we have noted that NCR and plus areas, the dark blue and the green line, show a steep increase at the end of July. In the recent week, a slight downward trend is seen. The rest of Luzon, which is the red line, continue to show an increase. Visayas, the teal line, show a plateau in the increase in the number of cases, and Mindanao, the yellow line, also exhibits continued increase in cases since the start of August. Nationally, we remain to be at high-risk case classification with a positive 2-week growth rate at 18% and a high-risk average daily attack rate at 18.56 cases for every 100,000 population. A decrease in 2-week growth rate is seen nationally and in 13 regions, which are the National Capital Region, CAR, Region 2, Region 4A, Region 3, Caraga, 11, 1, 9, 10, 7, 4B, and BARM. But majority maintains positive growth rates. Region 7 and 10 now show a negative 2-week growth rate. The national bed and ICU utilization rate at high risk with 71 to 77% utilization. 9 regions are with high-risk bed and ICU utilization. These are NCR, CAR, Region 4A, Region 2, Caraga, Region 3, 11, 1, and Region 12. 4 other regions are either with high-risk beds or ICU utilization, and these are Region 6, 5, 10, and BARM. We would like to flag the National Capital Region, CAR, Region 2, Region 4A, Caraga, 13, 11, 1, 12, 6, 9, and Region 5, with high-risk case classification based on its moderate risk 2-week growth rate and a high-risk average daily attack rate. The National Capital Region maintains positive 2-week growth rate and a high-risk average daily attack rate and is currently at high-risk case classification. The average daily attack rate increased from 33.71 in the previous week to 39.56 per 100,000 population in the recent week. In the National Capital Region, the 7-day moving average shows a slight decrease as cases in the recent 7 days have decreased compared to the previous 7 days by 780 cases. The whole of the National Capital Region is under Alert Level 4. Now, we also see in the National Capital Region, our case data show that cases in NCR continued to increase but at a slower rate. This is evidenced by the positive growth rates over the past month. As of September 19, our 2-week growth rate was 17%, lower but still positive versus the 2-week growth rate 3 to 4 weeks ago at 32%. Also, our 1-week growth rate was 36.77%. The continuous case increase was also evidenced by a higher average daily attack rate in the recent 2 weeks at 39.56 per 100,000 population versus the 3 to 4 weeks ago at 33.71 per 100,000 population. Lastly, previous projections done by Faster with the STWG on data analytics estimated the peak in daily cases in NCR to occur towards the end of September or early October. This delayed peak may be due to a slowdown in the case increases brought on by implemented community quarantine restrictions, improvement of PDITR, and vaccination. thereby leading to a longer period before we reach the said peak, but with markedly smaller number of cases versus an early and steeper peak with a larger number of cases. We noted that these estimates may differ from what we previously reported, probably because of the compliance to minimum public health standards. There is lower mobility and vaccination coverage is higher than what was assumed and included in our projections. Because of this, these latest projected daily cases may also differ from our actual numbers by the end of September or October, depending on whether inputs so mobility, minimum public health standards, health system capacity, the rate of Delta transmission, and vaccination coverage will also change in the next weeks. Again, we reiterate, these projections are not set in stone, as we regularly update our projections, which are also driven by changes in our assumptions. At the national level, deaths had been increasing since the last week of July, and a new peak was seen mid-August. With incoming deaths report, current numbers are still expected to increase. Evident here as well is the increase in the number of deaths for Regions 3, violet bars, Region 4A, which are the teal bars, and Region 7, the orange bars. Their contribution to the total number of deaths is seen to be increasing in the past week. The average deaths per day in August of 2021 is now at 155, and this has exceeded the deaths last April of 2021. Partial data for September show an average of 99 deaths per day. We are closely monitoring Regions 3, 4A, the National Capital Region, Region 7, 2, 6, and 1, and CAR, as these regions posted the highest total deaths for the first 2 weeks of September. Their average daily deaths also show an increasing trend since August. We looked at case fatality rates per region, and we saw that the national case fatality rate was lower this year than last year at 1.47% versus the 2.47% in 2020, despite cases and deaths increasing by more than twofold this year. While the National Capital Region had the highest cases and deaths in both years, it has a case fatality rate of less than 1%, and has the lowest 2021 case fatality rate, 0.89%, among all of the regions in the country. It is also noted that NCR is the only region with full vaccination coverage of more than 50%. Conversely, while CAR is second among highest percentage for full vaccination, its case fatality rate increased from 1.30% to 1.89% this year. Still, a significant reduction in case fatality rate was seen in most regions this year, most especially in the National Capital Region in Calabarzon. CFR of Region 7 and 11 were also halved this year. However, based on the overall case fatality rate, majority of our regions maintains case fatality rates higher than the national data. Region 7, 4B, BARM, Caraga, and Region 9 with the highest overall case fatality rates. Despite higher number of cases and deaths in 2021, case fatality rates are lower for 2021 with significant decrease for cases aged 60 and above. Given this number, here are our action points for this week. First, continue strict enforcement of minimum public health standards, especially in areas or activities which includes the 3 C's. These would be closed spaces, crowded places, and those that can have opportunities for close contacts. Second, do active case finding and immediate isolation in granular lockdown areas. Third, ongoing augmentation of our health system capacity and the transfer of asymptomatic and mild cases to community facilities. Fourth, continue monitoring cases and healthcare utilization so that we can adjust specifically for policy and response. Continue implementation of border control restrictions and policies. Continue coordination among the national and local government, and continue to provide up-to-date information to the public. So that is all. Thank you. Over to you, Lindsay.
Thank you po, Yusek. I will now be going through the questions sent to us by our media partners. Question po from Giselle. According to NTF spokesperson Resty Padilla, the enforcement of Alert Level 4 in NCR could be extended for 2 more weeks. But a group of health professionals said that the region should be under the strictest level of new quarantine classification. What's the DOH recommendation or position on this? And may chance bang itaas sa Alert Level 5 ang NCR sa mga susunod na weeks?
Yes, Giselle, no? So we just like to clarify that we are doing a pilot implementation here in the National Capital Region. And when we say we're doing a pilot, we are trying out these different interventions that we have identified. Plus, we are reviewing our metrics so that we can be able to have appropriate metrics by the end of this pilot implementation. Having said that, we are regularly reviewing. We have regular meetings with our implementers and also with our data analytics team so that we can be appraised or apprised of this progress of this implementation. But looking at how we are implementing right now, we cannot say yet as to the progress or what should be the next level of alert level because we still need to assess. Kakaumpisa pa lang po nung pilot implementation, so hindi pa ho natin masasabi yan. And having to say na mag-extend ba tayo o itapagpapatuloy natin will all depend on the assessment that we will do dito sa pilot implementation na ito. So hindi pa ho natin masasabi ito if we extend or not because we still need to look at our progress and the metrics that we have to say if we need to extend or it should be rolled out already for the rest of the country.
Thank you po, Yusek. Yusek, for clarification, are we already allowed to vaccinate children aged 12 to 17 years old? May guidelines sa po ba para dito? And sino po ang uunahin at kailan po natin target sisimulan?
Yes, Giselle, no? So hanggang ngayon po, hindi pa ho na ibibigay ang kompletong rekomendasyon ng ating all experts. Maari tinutukoy nyo yung naging interview po ni Yusek Mirna dun sa isang show no these past days and we'd like to emphasize no that she might just be referring to the emergency use authority given to Pfizer and Moderna na kung saan may EUA naman po talaga ang Pfizer and Moderna na 12 to 17 years old maari nang gamitin. Sinasabi ng EUA, but this still has to be supplemented by the recommendations of DOH based on our experts group recommendations. So ngayon po, pinag-aaralan pa rin po maigi ng ating mga experts and foremost para sa ating mga experts would be the safety and the equity component of this. Dahil hanggang sa ngayon, ang kanilang punto pa rin, kailangan makita pa rin natin mabakunahan yung mga vulnerable groups. Kasi pag tinignan po ang analysis, even though children are getting infected now, those who are at most risk of dying, of getting severe disease or being hospitalized are still the adult age groups. Yun pong ating mga vulnerable groups. Kaya ang atin pong mga eksperto, they really would want that these adult groups be vaccinated. Kapag stable na yung supply natin, tsaka po siguro magkakaroon talaga ng diskusyon about the children's vaccination. Although as I've said, pinag-aaralang maigi and yun pong isa pa yung safety, gusto po nilang pag-aralang maigi yan. Kasi ito po, mga bata na po yung babakunahan natin. And we would like to assure and to ensure that these vaccines will be safe among our 12 to 17. Although may EUA na, gusto lang po natin makasigurado what will be done operationally so that we can ensure that we can monitor these children.
Thank you very much for Yusek from Miguel. Some patients say kahit yung bericitinib as an alternative drug for tocilizumab ay mahirap na daw po makabili sa pharmacies dahil nagkakaubusan na din daw po. Do we still have enough bericitinib supply in the Philippines to assure na kahit limited ang supply ng toci, until the end of the year ay may alternative drug po tayo?
Wala po tayong shortage ng baricitinib. It has a CPR, so it is readily available. Yun lamang po siguro talaga na yung mga suppliers, no, minsan meron din sila kasi mga allocation per area. Baka lang po ganun. Ano? But we do not have a shortage because we closely coordinate with the Food and Drug Administration, pati po yung pharma division natin. Minomonitor po natin ang availability ng mga repurposed or investigational drugs ngayon dito sa ating bansa, so that we can direct also our clinicians kung saan sila makakakuha. And sa ngayon, wala pa ho kaming monitoring na may shortage tayo nitong baricitinib. As to tocilizumab and the other investigational drugs, we are also monitoring them and patuloy po ang pakikipag-ugnayan natin sa mga embassies at saka sa iba pa hong mga manufacturers and suppliers outside of the country so that we can be able to access these tocilizumab doses. Nakipag-usap na ho kami sa UNDP. Ito po ay isang development partner natin na kung maaari maka-access sila globally at a much lower price para po maitulong nila dito sa bansa natin. So tinitignan ho natin lahat ng anggulo kung saan tayo pwedeng makakuha nitong mga supplies natin so that we can provide to our severe and critical cases here in the country.
Thank you, Yusek. From Bons Magsanggol, what is our stance on giving incentives for vaccinated individuals? DOH in the past months thumbed down proposals giving privileges for vaccinated individuals as vaccinated supplies remain limited in the country. But with the implementation of alert level systems, vaccinated individuals can avail of dine-in services.
Yes, no? So kailangan maintindihan natin, Bonds, this is a pilot implementation. So whatever we can be able to try on dito sa mga pilot implementation ay sinubukan na. And kailangan din maintindihan ng ating public, it is not just DOH deciding when in terms of this kind of policy shifts. It is the whole interagency task force members na nagdesisyon ukol dito. At alam po natin na meron din naman pong mga economic managers within this IATF who would want to try also if we can start opening our economy when we do this kind of policy shift like granular lockdowns and the other interventions. So tayo, nananatili po tayo na sinasabi natin na dapat ang atin pong mga kababayan, they are cautious because there should be no difference between vaccinated and unvaccinated ngayon dahil po kahit po kayo ay bakunado, maaari pa rin po kayo magkasakit at maaari pa rin kayong makapanghawa sa ibang tao. So nandun pa rin po yung ating warning sa ating mga kababayan. Although as I've said, this is a pilot implementation. We are trying it out. Pag nakita po natin during this pilot implementation that it cannot happen because the risk is mataas at merong mga nagkakasakit, ititigil po. Pero ngayon, kailangan din natin subukan para po makita natin what should be our transition plan, no? What should be our direction in the coming months in terms of balancing both health and the economy.
Thank you, Yusek. From Greg, our worldindata.org shows that as of September 14 data, Philippines ranks 14th among countries in East Asia and Southeast Asia with 15.62% of its population fully vaccinated. What is your reaction to this?
14th among Southeast and East Asia. Kung ano man po yung kaya nating gawin dito sa ating bansa, yun yung gagawin natin. Kung ano po yung natatanggap natin na supplies, agad-agad po nating ibibigay yan sa ating mga kababayan. Pag tinignan po natin ang ating vaccination coverage, comparing this from March and April, napakalaki na po na na-improve natin. Comparing also from the first 3 months that we were receiving our supplies, ang dami na ho nating naidagdag. And the commitment for these supplies ay dumadating na po isa-isa. And what Secretary Galvez has mentioned na bago matapos ang taon, maari matanggap po natin itong mga doses na kailangan natin para masiguro natin at least we will get population protection. So kung ano man po yung ating bilang o ranggo internationally, what we should focus on would be our country, how we are faring, how we are protecting our citizens.
Thank you very much po, Yusek. I will now be going through some questions raised here sa ating Zoom chat box. Apologies sa mga hindi natin mababanggit since may next commitment pa po si Yusek from Aiko Miguel. Ilang beses po pwedeng ma-reinfect ng isang tao lalo na po kung hindi vaccinated? And possible po ba na mas malala ang condition in second or third infection at maka-experience po ng long COVID ang isang tao?
Aiko, walang kompletong ebidensya para masabi na kung ikaw ay nagkaroon ng second or third dose ay mas malala ang nakukuha mong sakit, no, from COVID-19. But yes, totoo yan. Meron na ring maliliit na mga pag-aaral na nagsasabi na kahit na pangalawa, pangatlo, pwede kang magkaroon ng reinfection, no? So hindi ka nagkakaroon ng total immunity from this virus. You can still get the infection as soon as your immunity wanes, no? Halimbawa, nagkasakit ka, syempre meron ka pang mga antibodies in your body, but it doesn't remain for your lifetime. So mai-infect at mai-infect ka pa rin. Kaya nga ang paalala natin, magpabakuna tayo at saka lagi natin gagawin yung minimum public health standards para kahit na tayo ay lumabas o di kaya ay tayo ay nagkaroon na ng infection, sigurado pa rin po tayo na hindi tayo mahahawaan at hindi na tayo magkakasakit ulit.
Thank you, Yusek. From Sheila, saan po natin maaaring attribute ang new peak ng deaths in August?
May mga factors tayo, Sheila, on why there is an increase in the number of deaths, no? Especially itong sinasabi mo na nag-peak tayo noong August. Unang-una, kailangan natin makita yung taas ng kaso natin ngayon kumpara dun sa ating previous na mga pagtaas ng kaso, yung peaks natin last March and April and last year in 2020, twice as much ang numero ng kaso natin ngayon. Ganun kadami. As your number of cases increase, your deaths will increase. Kasama po yun sa kanyang mga analysis. Pangalawa, hindi po natin directly ma-attribute sa kakulangan ng ospital, sa kakulangan ng gamot, ang mga pagkakamatay. Pag tinignan mo kasi natin, yung trends po ng mga kaso natin, naandun pa rin yung higher risk of dying sa ating mga senior citizens at saka dun sa ating mga kababayan na may comorbidity. So sila pa rin po ang talagang apektado in terms of the severity of disease and death. So we cannot really attribute it to just one factor. And the most plausible explanation for now, the numbers of deaths are increasing because the cases are increasing also.
Thank you po, Yusek. From Leigh Alves, may mungkahi po for a shorter quarantine period for vaccinated travelers from North America. Ano po ang posisyon dito ng DOH?
Yes, Leigh, no? So ito pong ating protocol na pinapatupad ngayon ay adopted po from the US CDC na risk classification. So kung ano man po yung risk classification natin ngayon, ito po ay base rin sa isang international reputable organization na nag-classify. At dyan po sa classification na yan ng North America, classified siya sa yellow country. North America is comprised of about 23 countries. 22 of these 23 countries are classified as yellow, no? Or moderate risk po sila. And ang protocol na pinapatupad natin dito sa ating bansa, because we still want to restrict so that we can control the entry of further variants of concern, is yung green countries lang muna po tayo. Ibig sabihin itong green countries, sila yung mga low-risk countries sa ngayon, base sa CDC, na pinapayagan natin, basta fully vaccinated, to have shortened quarantine period. But for North America, hindi pa ho natin yan mabibigyan ng rekomendasyon dahil katulad ng sabi ko, most of their countries still are at that moderate risk classification.
Thank you, Yusek. The COMELEC is planning to use antigen testing in screening those that will participate in the COC filing. Does the DOH believe that this is among the appropriate usage of antigen testing, as you mentioned last week? And if not, what would the DOH recommend as the screening protocol of COMELEC?
Yes, we do not recommend the rapid antigen test kits to be used as a screening test for people who will vote or for people who's going to join events. Kaya nga sabi po natin last week, kailangan appropriate yung use para wala tayong question as to the results that will come out if ever we use it. So amin pong makikipag-ugnayan din tayo because ang COMELEC naman po nakikipag-ugnayan sa atin, nakikipag-usap po sila sa amin tungkol sa mga health protocols. Kasama pa rin naman po kami nagbibigay ng mga recommendations. So we will be discussing this with them para po appropriate na mga testing protocols ang maisagawa natin sa ganitong mga events na ito.
Thank you, Yusek. Clarification po from Sheila. Ano daw po yung particular na investigational drugs ang inilalapit natin sa UNDP?
Yes, no? So we had a meeting with UNDP last week and we specifically requested that the national government or the Philippine government, no, ay mabigyan ng assistance in terms of procuring tocilizumab from the international markets.
Thank you, Yusek. Bakit daw po konti lang ang nasample ng PGC? Sara na po ito.
Nagkaroon po tayo ng mga na-quarantine na mga empleyado po ng Philippine Genome Center for these past 2 weeks. Kaya po medyo nag-downsize ang manpower, kaya po itong run natin ay kakaunti lang sa ngayon. Pero matatapos na po ang quarantine ng mga empleyado nila and hopefully this week ay makabalik na po tayo dun sa dati nating operations.
Thank you, Yusek. Yusek, question po ni Red, bakit daw po may mga differences sa mga projections po ng experts and different independent groups po?
Red, when you do projections,
Differences sa mga...
Red,
Yun po yung...
ako na, Lindsay.
Okay,
When you do your projections, you use assumptions, no? So, nag-project tayo ng hanggang end of September, ano yung magiging numero ba? Para makabuo ka ng ma-estimate mo at makita mo yung forecast kung ano yung mga numero by the end of September, kailangan meron kang assumptions, no? May assumption ka na may Delta variant dito sa lugar na ito. At ang Delta variant can infect 5 to 8 persons in just one sitting. May assumption ka rin dapat na ano ba yung mga factors na pwedeng makapag-prevent naman, no, nitong ganitong klaseng transmission. Kaya nilagyan natin yung ating projections nung ating compliance sa minimum health standards, yung ating immediate detection to isolation na shorten yung period, at saka nag-i-improve yung vaccination coverage. And most importantly, syempre, yung numero ng kaso. So kaya yung projections natin, pwedeng mag-iba dun sa mga independent research groups kasi baka iba din yung assumptions na ginagamit nila. So ngayon, kapag nag-i-interpret ka naman ng projections, kailangan pag nag-interpret ka kasi we have numbers eh. But you need to interpret it in that manner where you are considering also the other factors. Like you are considering the current caseload at kung ano pa yung iba nating sinasabi. Kaya hindi kami immediately will tell you, oy, may peak na tayo ngayon. Kasi tomorrow it might be different. No? So kailangan meron din po kaming cautiousness when we try to inform the public. We would like to explain things properly, give every information to the public, but we cannot alarm them. So kailangan lang po, base po kami sa ebidensya, base po kami sa datos, base po kami sa projections na ginagamit natin. At ang lagi po namin pinapaalala, ang projections po ay mga estimations po ito. Maari po itong magpalit, maaring hindi mangyari base sa assumptions na ginamit natin. Pag na-improve natin ang vaccine coverage, pag na-shorten ang detection to isolation, nag-improve ng compliance sa minimum public health standards, maaring hindi natin marating yung numero na sinabi ng projections. That's why we always say that so that ang mga tao alam nila na kung tayo ay magtutulong-tulungan, yung mga numero na sinasabi natin na maaring naandyan by the end of September or October might not really happen.
Thank you po, Yusek. Follow-up lang po ni Greg. Yusek Mir na mentioned about 10,000 wasted dosage in the country since we started vaccine rollout. May we get further details on this po?
As to the details, Greg, what do you mean by details? So the specifics, this is the totality of all the wastage. Yun yung binanggit ni Yusek Mir na mula pa nung nag-umpisang magbakunahan hanggang sa ngayon, iyan po yung total natin. And when we look at the number of vaccines that were already provided to the population, which is about 40 plus million already, comparing itong 10,000, this would yield a very, very short or a very, very small percentage among those vaccines that were already inoculated to our individuals. So marami pong mga naging cause ito, but basically the number one cause, of course, yung mga breaches ng pagpapatupad nung kanilang logistics protocols. Pangalawa, syempre, meron mga unforeseen events na nangyayari. Meron pong mga bagyong dumaan, meron pong nawalan ng kuryente, meron pong sa transport pa lang nagkaroon na tayo ng problema. But again, let me go back. Ito pong 10,000 ito, napakaliit po na porsyento na ito pag kinumpara na po natin sa overall na mga naibigay na nating bakuna dito sa ating bansa. And dun sa binibigay na ideal ng ating World Health Organization, kasi ang wastage naman po, hindi po yan naiiwasan. Wala pong perfectong vaccination system sa buong mundo. That's why ang WHO, meron sila lagi talagang sinasabi that this is the 5% wastage which is acceptable for everybody, no, for all the countries. And yun pong ating 10,000 ay naandun pa rin tayo within acceptable range.
Thank you, Yusek. From Caroline, ma'am, are we seeing more asymptomatic cases this August to September compared to the previous months? And kung mas maraming asymptomatic, what does it mean?
Mas ganun pa rin ang trend natin, Caroline, ano? We have 9 asymptomatic and mild cases pa rin ang nakikita natin. Although marami ang merong nagkakaroon ng mild cases sa ngayon, ang asymptomatic cases natin ay hindi pa ganun kadami, no, sa nakikita natin sa ngayon. So pareho pa rin po ang trend natin, 90+% would be mild and asymptomatic cases, and only about less than 3% or 3% would be our severe and critical cases.
Yusek, we've been receiving clarification po ulit. If we could reiterate yung explanation or nasabi niyo na po earlier in your presentation, cases daw po may have already peaked in NCR.
Katulad ng naipaliwanag natin kanina, di ba? When you say it's a peak, ito po yung pinakamataas na numero ng kaso na nare-report in a certain period of time. Tapos, syempre, peak siya, i-expect mo pagkatapos nun, tuloy-tuloy nang bababa ang mga kaso. That's the peak, no? So pag sinabi po natin yun, hindi natin masabi ngayon. Pag tinignan po natin, kailangan pa natin pag-aralan pa maigi yung datos natin. Patuloy pa rin tumataas ang mga kaso natin sa National Capital Region, although bumagal ang pagtaas, pero tumataas pa rin siya. Base rin dun sa projections natin, sinabi na nung ating faster projections na baka ang peak natin mangyari pa yan towards the end of September or early October dahil pinabagal na ng mga ginagawa nating intervention itong patuloy na pagtaas ng kaso. Ibig sabihin, kung hindi natin nagawa yung mga interventions natin in the previous weeks, maaring nag-peak na to ng pinakamabilis na pagtaas ng kaso. Pero sa ngayon, wala pa tayong ganun. Pinabagal niya itong pagtaas ng kaso. Kaya yung peak, hindi pa ho natin nararanasan at kailangan pang pag-aralan pa.
Thank you, Yusek. That's all the questions that we can accommodate for this morning. Before we officially end our media forum, do you have any other final messages to our media partners and of course to our viewers?
Yes, sa ating pagtatapos ng ating media forum, mahalaga po na alalahanin natin na dapat sinusunod natin ng mahusay ang lahat po ng paraan na meron tayo upang labanan natin ang pagkalat ng COVID-19 sa lahat ng lugar dito sa ating bansa. Nasaan man po tayo, maging sa gitna ng biyahe sa ating mga trabaho o maging sa loob ng ating mga tahanan, tiyakin po natin na sinusunod natin ang minimum public health standards para sa kaligtasan nating lahat. Kasabay nito, nananawagan po ang Department of Health sa lahat ng ating mga local government units, mga lokal na pinuno at mga leader ng ating komunidad, ipatupad po natin na mabuti ang minimum public health standards at maging alisto po tayo sa pagbabantay ng ating mga komunidad. Kaligtasan at kalusugan ang layunin ng ating mga interventions, kaya't ipatupad po natin ito ng mabuti. Bilang mga pinuno at leader ng ating mga komunidad, ang boses po natin ang dapat nagiging gabay ng ating mga kapwa at nasa ating mga kamay ang kapakanan ng buong bansa. So maging mahusay po tayo sa ating pagpapatupad pagkat ang ating kaligtasan ay siya susi ng pagbangon ng buong bansa. Maraming salamat po sa inyong lahat and we will see all of you next media forum this week. So, salamat. Thank you, Lindsay.
Thank you, Yusek, and thank you, everyone. Have a safe